So I'm going to turn now to the last area that I was going to provide updates on, which is related to testing, just because there was an additional announcement from the province related to testing specifically in schools. So this was an announcement made through the Ministry of Education regarding expanding access to rapid testing for schools. And so I just wanted to cover the main components of that announcement. So there were really three things that were incorporated into that announcement. The first was related to employees at schools that were not vaccinated and requirements for them to participate in rapid antigen screening to continue to work at schools. So health units are not involved in that. We don't provide the tests or follow up. This falls to the school boards and the schools to implement, but that was one component of the announcement. The second component was specific to students regarding the rapid tests that are PCR tests. So these tests are for children that have symptoms that could potentially mean COVID-19, or for students that are identified to be a high-risk contact. So they could have been maybe a classmate or on the same bus as a student with confirmed COVID-19. These PCR tests, according to the announcement, will be sent directly to schools and made available through schools to students that fit this criteria. The reason I think that this approach will be helpful overall provincially is that it might speed up the process for returning some students to school if there are longer waits to get into assessment centres. So typically those students that either had symptoms or were identified as a high-risk contact would have to go to an assessment centre to be tested. This new approach will mean they might be able to access the test through school, do the test at home, and then drop it off at a specified location so that they're not having to wait on an appointment at an assessment centre. So the health unit's not involved in distribution of these tests at all, or monitoring and follow-up of that process. That has been kind of issued and being followed up through the Ministry of Education and with school boards and schools directly. The third component of the announcement was the rapid test, which is the rapid antigen test. So this is different from the PCR. This is the test that is offered for students, or adults for that matter, that do not have any symptoms and are not high-risk contacts. So the province had previously announced that they wanted to expand access to rapid antigen screening for students, and previous instructions had indicated that really local medical officers of health and health units would determine at what time rollout of these tests would be most useful, recognizing these tests are not perfect and have a very kind of specific use to support when there's a higher load of COVID-19 in the community or higher prevalence of COVID-19. What was included in the announcement was they labeled it as a test to stay program, which is really similar to the previous scenarios we were already discussing about when we might use this type of test. So when we might see the use of a rapid antigen screening test used in a higher amount at a school setting would be, for example, if we were looking at an entire school being closed because of an outbreak. So the rapid antigen screening test might be helpful for those classes that don't have a confirmed case. So none of the kids are high-risk contacts, none of the kids have symptoms, but if they're able to participate in the rapid antigen screening testing, it might help prevent them from having to stay at home. They can continue in-person learning. Or another scenario might be if a school was closed because of an outbreak and is seeing some students returning to class maybe sooner than what had otherwise been in practice. Again, as long as these are students that are unvaccinated, don't have symptoms, and are not considered to be high-risk contacts. So I did want to remind people that to date across HKPR for our region, we've had 20 cases identified among school-aged cases and staff or teachers at schools. And we have not had any outbreaks associated with schools of COVID-19 to date in this school year. So I think, knock on wood, we've been in a good position moving forward and haven't had the reason to need to roll out this testing, although we will continue to discuss and work with our partner school boards to determine what the right scenario is, what the right situation is, where we will start to employ some of this broader rapid antigen testing.